I start my day at 7:40 and we work until noon, and then from 12 to 1 we have a provider meeting. So all of the doctors and nurse practitioners sit in a meeting and we share cases of stories of different challenging clinical situations. So Wednesday's our provider meeting day, but otherwise I work kind of 4 hours. We get an hour off for lunch. We catch up on charting, call specialists, and then we work another 4 hours. So that 8-hour day is mixed in with acute visits, which could be an urgent visit for cold symptoms, stomach pain, urinary symptoms. I had a lady I followed up today for her high cholesterol. I did 2 physicals this morning. You see kind of everything. And this afternoon will be the same. We do a lot of chronic pain management. I have someone coming in for that, a lot of diabetes. So that would kind of be a typical day. We do have a doc that has taken the position as being a medical director, but for the most part, there is what we call pods. So we have 3 different pods. So my pod is myself, Dr. Sayak, and Dr. Zebka. So if Dr. Sayak is not available to see a patient, they would try to schedule that patient in with me. So their patients are getting continuity of care. So I have my own panel of patients, so I probably have 100 patients assigned just to me. So Edith is just my patient, but most of who I see are either Dr. Sayak's patients or Dr. Zebka's, and they're not available, so they see me. What I did as a registered nurse is I worked on a med-surg floor, so I would have 6 patients, for the whole 12-hour shift, and it was just busy. And your patients were in and out, and this is lovely. Like Edith, I've been following now for a year, but I see her like every other week, so I really get to know her well and kind of follow. We can do a lot of preventative medicine. We can do a lot of acute visits. We do all our physicals. So I really get to know everything about her, not just one episodic illness in the hospital. So, in internal medicine, you have to know a lot. And I feel like there's so much to know. We know a little bit about so many aspects of care, but for the most part, we really manage chronic medical illnesses. We have a lot of geriatric patients that have multiple medical issues, and they're on many medications and social issues and family dynamics. So we do a lot of care. It's good. We have busy schedules. We see a lot of patients. It's busy. We really do a lot. Some nurse practitioners can see patients in the hospital, so I see patients here and I go in the hospital and I'll admit patients over there. There's probably some skills that we can't do unless you're trained. Like for instance, I don't do any injections or I don't do suturing, but those are all things we can get trained to do. I guess it would just be some really advanced chronic management of diseases that we just didn't have enough experience in. But we work directly with the doctor, so if there's something I'm not sure of, I always just collaborate with our physicians, but they're so helpful. So when I was first out of school, what I really like to do is teach. So I teach part-time at St. Anselm College, and I always knew I'd want to teach nursing, so I knew I needed my master's. So I started with my master's program, and I said, I might as well be a nurse practitioner if I'm going to get my master's. And then I just decided I really liked it because I get one-on-one. Like I'm in this room with one patient at one time, and I get a full 20 to 40 minutes with that patient. So that's nice. But I'll tell you, most of the visit we just chat. Yeah. So most of what nurse practitioners do is we really just take a longer time to just listen. We don't just. She came in for her ear, but we also talked about her husband. We talked about what was going on last week with a different office visit. So we really try to just look at everything. Wouldn't you say?
Yeah.
You came in for an ear, but you got a lot more, right?
Yeah.
Yeah.
I usually do.